Welcome to Scholar in Session. Our video will look at an important paper in ATS Scholar. Here, we discuss gender disparities in critical care procedure training of internal medicine residents by researchers from University of California, San Francisco and Mayo Clinic. Procedural training is an essential part of internal medicine IM residency and can determine a resident's core competencies. While a few studies have looked into the procedural training experiences of IM residents, gender disparities in this context have not been investigated. In a recent study, researchers from Minnesota and California examined the role of gender in regulating access to procedural training among 399 IM residents from two large academic residencies, designated Program A and Program B. They performed a gender-based comparison of the rates and volumes of a total of 4,020 procedures, including ICU procedures and structured procedural services, and developed semi-structured focus groups to gain a more qualitative understanding of the impact of gender on exposure to procedural training. In Program A, women residents performed only 47% of ICU procedures, which was lower than the 54% expected based on their ICU rotation schedule. However, there were no gender-based disparities in procedural volume in Program B, ICU procedures, or structured procedural services at either of the two residencies. Women from both residencies, however, believed that assertiveness could help gain access to procedural training in unstructured learning environments. Residents also felt that gender can influence access to procedural opportunities, ability to self-advocate for procedural training, their identity as a proceduralist, and confidence in acquiring procedural skills. These findings suggest that by allocating procedural training in a more structured manner, IM residency programs can ensure equal access to procedural training for all genders. For more details, please read the article by Dr. Emily M. Olson and colleagues. Thank you for watching Scholar in Session.